The following information is intended for educational purposes only. It is not medical advice. The views expressed do not necessarily reflect those of A Rood Awakening International nor this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor A Rood Awakening International nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
Statin drugs are the most profitable drugs in the history of pharmaceuticals, and yet they fail to prevent or treat heart disease for almost everyone who takes them, and they're causing more harm than any other class of medications. In fact, statins are effective for approximately 1% of those who take them. In other words, statins fail 99% of those who take them. Not to mention, cholesterol is not a harmful substance. In fact, it's essential. But how can this be? Why have we been taught that cholesterol is the enemy and statins are the answer? Dr. David Brownstein, author of the book, The Statin Disaster, is with us today, and he's about to give you a health awakening. Welcome to the Health Awakening. I'm your host, Scott Laird. Yes, you heard right. Cholesterol is not a harmful substance. In fact, it is an essential substance that is needed by every cell in the body. We can't live without adequate amounts of cholesterol. And ironically, the statin drugs that are used to lower it are associated with a host of serious adverse effects, including ALS, breast cancer, congestive heart failure, kidney and liver damage, memory problems, muscle weakness, neurological disorders such as Parkinson's disease and thyroid disorders as well. Our guest today is Dr. David Brownstein, who wrote the book called The Statin Disaster, in which he teaches you the steps you can take to prevent becoming a heart patient and how to holistically treat heart disease without statin drugs. Dr. Brownstein, welcome back to the Health Awakening.
Thank you for having me, Scott.
So we want to talk about statin drugs. There seems to be this notion out there that has been out there for many years that cholesterol, heart disease, it's sort of a cause and effect. Why is this a failed paradigm?
Well, Scott, there's really no good data that statins help nearly 99% of people who they're prescribed for. In fact, when you take into the adverse effects and the cost of them, I think it's a disaster that they're still on the market. If the FDA was working for us, we wouldn't have to worry about it. They would have pulled statins long ago because they fail the vast majority who take them.
So now there seems to be research out there. I saw a study this morning, 2013, that claimed that these drugs did in fact lower cholesterol and therefore are good for preventing heart disease. So is this maybe these results look better than they actually are, or why are there results out there that look positive?
So, Scott, the theory that cholesterol causes heart disease started in the early 20th century when researchers from Russia fed rabbits cholesterol, and the rabbits developed atherosclerotic plaques similar to the way humans do. So that was where the theory started. The theory was perpetuated in the 1950s when Ancel Keys published his study that showed that higher fat in the diet is associated with more heart disease. And since then, drug companies and big pharma and mainstream medicine has been consumed with the idea that cholesterol causes heart disease. Now, if we go back to the beginning when they fed rabbits cholesterol and the rabbits developed atherosclerotic plaques similar to the way humans do, I say that's a failed paradigm because rabbits don't normally eat cholesterol in their diets. Rabbits are vegetarians, and they fed the rabbits the wrong food. But the early studies also showed that if the rabbits were fed enough iodine, they wouldn't develop heart disease even if they were given cholesterol in their diets. So it should have stopped from that point. But we have been on a journey, a 70-year journey of telling people to lower their cholesterol diet and lower their levels with drugs, and saying it's going to lower the risk of heart disease. But that's just not so. 99%. So when I have a medical student in my office, first thing I do is I give them an article about that. I ask them, tell me how effective these drugs were. Because the article I give them is called Crestor. It's what gave statins the indication for primary prevention, meaning people who had never had heart disease are prescribed statins so they won't get heart disease. That was the indication that this study gave them. So if you just look at the review of the study, the abstract, the study says 50% less heart attacks and 20% less mortality for healthy people with statin drugs. Well, you got to delve into it, and you got to figure out the statistics to show that the numbers are this drug failed 99.5% who took them, and they didn't get any benefit from them. And so it's my premise that statins have failed the vast majority. If you look at those who die from a fatal heart attack, over 50% have high cholesterol. What about the other 50%? They have low cholesterol. There's really no association. So I think that it's just a marketing ploy, and I think that it's made our country poorer and sicker, and I think these drugs should be pulled from the market. They just don't work. They don't work for women. They don't work for healthy people. And for those that have had a heart attack, there's maybe a 1% benefit of less non-fatal strokes and heart attacks who take a statin. Nobody lives an appreciable longer amount of time if you take a statin. And there's really no reason to take them when they're associated with all the adverse effects that you mentioned at the beginning of the episode.
So now what happens when someone goes to the doctor and they're told they've had high LDL, low HDL? Is there really a difference in what we're looking at there? Let's set the record straight on what is the difference there.
So, Scott, I can tell you that over 99% of doctors and medical students are unable to critically read a research study. They can't understand the statistics used to analyze a study. They can't make their own conclusions. They're relying on the abstracts and the conclusions in the abstracts. And these conclusions are based on faulty statistical analyses. And most research studies and all statin studies are done with a relative risk interpretation. And I explain to the medical students, when I lecture to doctors, I tell them how to pick up on this. And a relative risk analysis of any medical study should never be used when you're clinically deciding whether to prescribe a drug for anyone or not.
All right, Dr. David Brownstein, now hold that thought. We're talking with our guest today, Dr. David Brownstein, the author of The Statin Disaster. We're going to talk more about statin drugs, cholesterol, HDL, LDL. We'll be back with more from The Health Awakening. After the stoning of Stephen, Paul continued persecuting the believers in Jerusalem until they were forced to scatter to escape with their lives. In Scattered, Michael Rood brings behind-the-scenes clarity to the incredible true accounts of the apostles in their first solo assignments, fearlessly spreading the word and performing miracles in the name of Yeshua.
You're not going to go through all of the cities of the Israelites before the Messiah comes. That's what he said. What does that mean? That Israel's been scattered all over the world.
Learn the little-known details about the apostles' epic battle of miracles against demonic resistance, a spiritual awakening that began a ripple across the world. And today is our responsibility to finish.
Get out there in the world, mix it up. Do what has to be done.
Receive this exclusive teaching for a love gift donation of just $50. Or, with a gift of $100 or more, you'll receive Scattered, plus a gorgeous stone plaque, etched with scripture verses about the fruit of the Spirit. Display the Fruit of the Spirit plaque in your home as a testament to the character of the Almighty. Character that He desires to show others through you.
This is our time, ladies and gentlemen. We either change the world now, or the world is going to continue changing so fast we will not be able to keep up with it, and the persecution will be more violent than the world has ever seen.
Make your donation now. $50, $100 or more to receive these special gifts. Get the Scattered Collection, only in June. Call 800-788-7887 or visit our website to make your love gift donation now. And welcome back to The Health Awakening. Before the break, we were talking with our guest, Dr. David Brownstein, the author of The Statin Disaster, about statin drugs. And I asked Dr. Brownstein about research studies that seem to indicate that these drugs actually help. And Dr. David Brownstein, you were talking about how doctors can't seem to read these research studies right.
So we're not taught in medical school how to critically read a research study. As I was saying, most studies are reported in a relative risk format. That's an inaccurate way to report a study. And the reason Big Pharma does that is because it makes a poorly performing drug or therapy look much better than it actually is. So the statin drugs, when the studies come back that say they're 30 or 40% effective, what that means in most cases is they're 1% or less effective. So what I teach the medical students and doctors is how to figure out how many patients you need to treat with this drug to get this one effect from any research study. So in the case of statin drugs, for those who've never had a heart attack or a stroke, to prescribe statins to prevent their first heart attack or stroke, you need to treat somewhere between 200 to 500 people to prevent one case. That means it fails over 99% who take it. I think that's a ridiculous way to prescribe medicine that has associated with adverse effects and costs too much money. We should be prescribing drugs that work, and statin drugs simply don't work for the vast majority who take them.
Now, speaking of cholesterol, we mentioned that cholesterol is not a bad thing necessarily, and in your book, you talk about the biosynthetic pathway for cholesterol. Could you explain what that is?
So every cell in our body needs and produces its own cholesterol. Cholesterol is needed to protect the cell membrane. The highest concentration of cholesterol is in the brain. So statins poison an enzyme called HMG-CoA reductase. And by poisoning this enzyme, the cell is unable to make cholesterol and will lower the amount of cholesterol it can make. So statins are perfect drugs to lower cholesterol levels because they work at doing that. Problem is they don't work at preventing strokes and heart attacks for about 99% or more who take them. So when you deprive the cell of cholesterol, cell membrane's not healthy, the brain doesn't become healthy. Once you understand the mechanism of statins, you can figure out that's why statins are associated with so many memory deficits and Parkinson's and Alzheimer's, because you're lowering a vital substance that the brain needs.
Interesting. Okay, now we started talking about HDL versus LDL cholesterol. We always hear these two terms. Do people really need to be concerned about these? Yes or no, and why?
The short answer is no. So HDL and LDL are different lipoprotein molecules that carry cholesterol throughout the body. In a simplest term I can make this, LDL takes cholesterol from the liver and deposits it in the tissues, and HDL takes it from the tissues and brings it back to the liver. Now, everyone thinks HDL is good cholesterol and LDL is bad cholesterol. Nothing could be further from the truth. They're both essential substances that we can't live without in our body. Now, Big Pharma makes a big deal about LDL cholesterol because their medications affect LDL cholesterol numbers. The reason they don't make a big deal out of HDL cholesterol is their medications don't affect their numbers. Now, if you drop LDL cholesterol low enough, you're going to be at an increased risk for brain problems and for infections because LDL is needed to fight infection in the body. So you can predict that'll be a side effect of using statin drugs, and it actually is a side effect of using statin. So I say this whole LDL, HDL is all more noise and nonsense out there that people shouldn't be so concerned with.
Okay. Now, you have a special section about women and statins in your book. What's the significance there? Is it hormones and hypothyroid going through menopause? Is it associated with that at all?
Well, the first comment I'd make on that is there's not a single study that shows that women who have never had a history of heart disease or stroke benefit from any statin drug. They don't live longer, they don't have less strokes, and they don't have less heart attacks. So the other problem with statin drugs in women, actually it's in women and men, is that when they poison that enzyme HMG-CoA reductase, that's the step before the cell makes cholesterol. Well, the cell needs cholesterol to make hormones, and the hormones needed are testosterone and estrogen and progesterone and cortisol. And if you block cholesterol from the beginning, you're going to lower a person's hormone levels. So I talk about in the book how women's hormones get totally disrupted from statins. And it's not only women, but men suffer from it too because their testosterone levels decline. So again, when you weigh the evidence that statins benefit maybe at best 1% of people who take them or less, and you throw in the problems of brain dysfunction and immunity dysfunction and hormonal dysregulation, there really is no reason they should be on the market. And if the FDA was working for us, they would have realized this long ago and pulled these items from the marketplace.
All right, well, we're talking about statin drugs and should they be on the market or shouldn't they be? Our guest today is Dr. David Brownstein, the author of The Statin Disaster, and we'll be right back with more from The Health Awakening.
The Chronological Gospels Bible is changing lives all over the world.
putting everything the Messiah did in exact chronological order and explaining the behind-the-scenes truth of what the Messiah did, when he did it, and why. The timing of it all means everything. And now, the chronological Gospels can be easier on your eyes. The larger print edition features 40% larger type, and every page appears exactly the same as the original, so you can follow along with others who have the regular size version. The Chronological Gospels larger print edition also has wider margins to write notes, and the premium quality paper means you can highlight without soaking through. Plus, the larger print edition lies flat, so you can teach without having to hold the book open. The Chronological Gospels larger print edition is a big and beautiful coffee table book, measuring a full 12 inches tall and 9 inches wide. Order now and you'll also get 2 bonus CDs of Michael Rood's audio reading of the introduction section to the Chronological Gospels. Study the Bible with clarity and ease.
I love the size of this book. This is 9 by 12. The paper is perfect because it doesn't bleed through when I write on it. I can mark it up, and I always make notes in all my Bibles. Everything is the same place as it is on the smaller version, and I can just stand back and I can teach from it, and it's the perfect size.
Order the Chronological Gospels larger print edition by phone or online. You'll get 40% larger type than the original and the bonus audio CDs of the introduction, read by Michael Rood. Get the Chronological Gospels Bible larger print edition for just $69.95. Call or visit our website now. And welcome back to The Health Awakening. Before the break, we were talking with our guest, Dr. David Brownstein, about thyroid issues and hormonal issues and the result of statins on people who are taking other medications for these type of things. So Dr. David Brownstein, let's talk about men. Men are always encouraged nowadays to go check out low T, for low on energy, etc. We're asked to go check our hormone level. And you're saying that statin drugs can actually skew those results.
Well, Scott, if anyone would study the mechanism of action of statin drugs, it could be easily predicted that if you take a statin drug and you're a man, or a woman, you're going to lower your testosterone levels. And the reason is that enzyme, HMG-CoA reductase, that makes cholesterol, is poisoned when you take a statin drug. That's how it works. Cholesterol is the precursor molecule needed to make the adrenal and sex hormones of the body. So if you look at the pathway and you just go down the pathway, testosterone's in there. You can predict anyone who takes statins is going to lower his or her testosterone levels. And that's exactly what happens with men. That's why when men take statin drugs, their libido falls, their ability to perform sexually falls, and their testosterone levels can fall. And there's a whole host of degenerative changes that can happen when men get too low of testosterone levels. I've been checking men and their testosterone levels for over 20 years and seeing great benefits when testosterone is balanced along with the other hormones of the body. And a similar effect happens in women. They can take a statin drug and their progesterone and estrogen and testosterone levels will also differ. And I can tell you, Scott, men and women don't feel well when their hormones are imbalanced. The first book that I wrote nearly 20 years ago was called The Miracle of Natural Hormones. And I wrote that book because my dad was suffering from severe heart disease. He was on numerous medications to control his cholesterol levels. And the side effect of those were his hormonal system was in disarray. When I got my dad off the cholesterol medications and put him on natural hormones, he made a dramatic recovery in his heart disease. And that's what really started me on this quest.
So that's interesting. You put people on natural hormones. We'll have to make that another show and talk all about hormone replacement. But for hypothyroid, I know several women that I know are suffering with this. And I'm not sure if any of them are taking the statin drugs, but you're saying that could also have an effect.
Well, when statins dysregulate the adrenal and sex hormones, the whole hormonal symphony gets disrupted, and that can include the thyroid. So there's really no reason to disrupt a crucial molecule that's made in every single cell in the body by poisoning an enzyme. And without positive benefits in 99+% who take them, I can't quite understand why 1/3 of adult Americans are prescribed these medications and are taking them. I think it's a disaster, and that's why I titled the book The Statin Disaster.
So when someone goes to their doctor and the doctor says, we need to put you on this, this drug, the statin drug, what should they tell their doctor? What should they come back with?
Well, number one, they need to educate themselves how these drugs work in the body and what they do. So I think once people educate themselves on a lot of different medications and how they work, they'll be less likely to take them. So if you're going to be prescribed a drug, you need to ask the doctor, well, what's this drug supposed to do? And if the doctor says, lower my cholesterol levels, well, does that make me feel better? Does that give me less strokes or heart attacks? If the doctor says it does, then I would say find a new doctor, because that's just not the case for 99% who take it.
That's interesting. So then what is the real solution to heart disease? If someone's heading that way and they've got narrowed arteries, what do they do?
Well, I've written 15 books, and my books all have the same thing to them. I write about what works in my practice. So the real solution to heart disease is do the basics. And the basics are eat good food without refined food products, and that includes refined sugar, flour, salt, and oils. Drink enough water. There are studies in Switzerland that men who drink more than 6 glasses of water have 40% less strokes and 50% less heart attacks compared to men who drink less than 2 glasses of water. They need to get their hormonal system balanced and maintain their balance. They need to correct nutrient imbalances. And I can tell you, in our food supply right now, the vast majority of people have nutrient imbalances. I call this doing the basics. And when the basics are done, the human body was designed perfectly to provide us with health, provide us with enough energy into old age.
Something not directly related to statins per se, but it has to do with the diseases that supposedly statins help with, and heart disease. And what often leads to heart disease is high blood pressure, of course. And often people point the finger at salt. And I know you also have something to say about salt and health. Could we talk about that for a minute?
Sure. I have a book called Salt Your Way to Health. And the reason I wrote that book was the vast majority of people are actually salt deficient. So limiting salt in your diet triggers a response in the adrenal glands where certain hormones are released, which actually raise your blood pressure. So there's no reason to limit salt for the vast majority of people out there unless you have kidney failure. The human body was designed to need and acquire salt. We need over 100 grams of sodium and 100 grams of chloride every single day to live. And we don't have any stores of these. So either we get them from our diet on a daily basis or we become deficient in them.
So at the Brownstein house, I know what we have at the Laird house, but at the Brownstein house, what kind of salt do you use and why do you use that particular kind?
So in my book, I write about the difference between refined and unrefined salt. Unrefined salt has over 80 minerals in it. It's got its full complement of minerals wherever that salt was taken from. Refined salt that most of us are used to, that thin white stuff that gets through the small holes in the shaker, has no minerals in it. The minerals have been removed. They're actually referred to as impurities from the salt manufacturers. That's a refined, dangerous product that we don't need to use. And so I encourage people to use unrefined salt. In the Brownstein household, salt is kept on the table, it's kept out. My kids were told to salt their food from small age and carry the unrefined salt to restaurants. And that's the Brownstein house.
All right. Well, you've had a bonus today watching this show. Not only did you find out about statins, you found out about salt and what both can do or not do for your health. So thank you for joining us today. Our guest has been Dr. David Brownstein, and we'll be back with more from The Health Awakening to wrap this up. After the stoning of Stephen, Paul continued persecuting the believers in Jerusalem until they were forced to scatter to escape with their lives. In Scattered, Michael Rood brings behind-the-scenes clarity to the incredible true accounts of the apostles in their first solo assignments.
You're not going to go through all of the cities of the Israelites before the Messiah comes. That's what he said. What does that mean? That Israel's been scattered all over the world.
Receive this exclusive teaching for a love gift donation of just $50. Or, with a gift of $100 or more, you'll receive Scattered, plus a gorgeous stone plaque etched with scripture verses about the fruit of the Spirit, character that he desires to show others through you.
Get out there in the world, mix it up. Do what has to be done.
Make your donation now to receive these special gifts. Get the Scattered collection, only in June. And welcome back to the Health Awakening. Well, like we said before, you had a bonus episode today. We were talking about statin drugs and what you can do to avoid taking them, and maybe what you can talk to your doctor about. And also we talked about salt, and Dr. David Brownstein has been our guest today. Dr. David, I know that you have written more than 15 books, and a lot of your books cover these topics. So which ones would you recommend and why? And which ones would you like to particularly pay attention to?
I'd like to tell the listeners to don't put up with not feeling well, and don't put up with getting suboptimal answers from your healthcare provider. You need to educate yourself on what these drugs are doing, and you need to educate yourself on what natural therapies are available to you. My books are available at drbrownstein.com, drbrownstein.com. And I write them for lay people, I write them for doctors, because things should be simple enough for everybody to understand. If you're reading something that you don't understand, then I would say the person writing it probably doesn't understand it either. So I hope they'll give a look to some of the stuff that I've done, and I just want to promote health in our country.
All right, well, I appreciate that. I know I've got a couple of your books on my shelf. They're a great read, and like Dr. Brownstein says, they're easy to read. Pick them up. Again, for more information about statins, cholesterol, and diet, visit drbrownstein.com. Thank you, Dr. David Brownstein, for joining us today on The Health Awakening.
Thank you for having me, Scott.
All right, and we'll see you next time for another Health Awakening. Thank you for joining us today on The Health Awakening. You can catch the replay of this episode and see our complete show schedule at healthawakening.tv. For more information about our guests today and all they have to offer, please visit their website on the bottom of your screen. And please remember, the information you saw today is for educational purposes only. It is not medical advice, nor do the views expressed reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result. Thank you.